Hello and welcome to Clinical Exam Series with Dr. Piro. Today we are going to be discussing history taking. And first off, I just want to tell you how important history taking is to clinical practice. History taking sits at the very heart of clinical practice. If you are going to be a doctor, then you have to learn how to take a history, because that is going to guide the investigations that you are going to carry out and then the eventual treatment that you are going to give to the patient. History taking constitutes, we are told typically that from your history you can get as much as 70% of the information necessary to make a diagnosis for the patient. So it's important that we really learn how to take history. I can also tell you that history taking will not be learnt in a day. The more you practice, the better you get at it. And also history taking varies from department to department. So what we're going to be discussing here will be most appropriate for medicine and surgery. However, if you are doing obstetrics and gynecology as well as pediatrics, you will also benefit from watching this video. Most important of the warnings I should give you about history regards patient and the physician confidentiality. It is important for you to always remember that your oath is binding to you as a contract, as a social contract between you and as a medical contract between you and the patient, and you should keep every information discussed within that relationship, between that contract, confidential. You can only discuss the history of a patient with a colleague only if it bears direct correlation with the management of that particular patient. So whatever happens in the clinic stays in the clinic. This is the format you should use when you are, when you are reporting your history. First of all, we need to know the biodata of the patient. We need to know the complaints the patient has come with. We need to know the history of that presenting complaint. We want to know the past medical history of that patient. Now, in obstetrics and gynecology, we want to know the obstetric history of the patient and the gynecological history of the patient. We're going to talk more about this later. For a pediatric patient, we want to know the prenatal, natal, and postnatal history of that patient. We want to know the immunization history of that child. We want to know the dietary history of that child, and we want to know the history of developmental milestones about that. More of this for pediatrics will be covered in another video. Now, after doing all these variations, we want to know the family and social history, irrespective of the department. Now, we want to know the family and social history of that patient. We want to know history of drugs and drug allergies and allergies generally. Finally, we want to do a review of system. And at the end of all these steps that we have taken so far, we want to summarize the history, highlighting the most important information we have gotten from our history. I should tell you as a side note here that the review of system can be kept as the last before the summary, or it can also be included as part of the history of the presenting complaint. And in my own experience, when we put it as part of the history of presenting complaints, it helps us to be able to come closer to the diagnosis of the patient. Now let's go to the nitty-gritty in terms of history taking. Now for biodata, a good acronym to remember is NASIORATI. N will be for the name of the patient, A will be for the age of the patient, S will be for the sex of the patient, E will be for the ethnicity of that patient, O will be the occupation of that patient, and then T will be the tribe of the patient. I will be both for an informant, if you use an informant, for example, in an unconscious patient, or if you use an interpreter, in case you had language barrier. I should also tell you also that handedness can also be added as part of the biodata if the patient is suffering from a neurological illness. It's important for us to put handedness as part of the biodata. You should also know that if there are very important medical conditions that bear a close relationship with the diagnosis we are going to be making at the end of the day, it's important for us to bring it and put it as part of the biodata of that patient. So for example, a typical biodata will sound like this. I'm presenting a 65-year-old Fulani businessman who resides at Lekki area of Lagos. He's a Jehovah Witness. The interpreter is the wife, and the information is reliable because both spouses live together in the same house. So that is a typical example of a biodata that captures the key part of the biodata. The next will be the presenting complaint. So what is the complaint of the patient? How many are there? So the patient has three complaints: headache, fever, and breathlessness. So you have to capture the three of them, and then you arrange them in chronological order. Which started first, for how long, and then what progressed next, and then what was the most recent history before the patient presented to your clinic. It's important that we capture it in chronological order, because disease progressions follow a time pattern, a time pattern that will help us to be able to make a diagnosis at the end of the day. The heart of your history taking is going to lie in the history of presenting complaints. And to help us to be able to follow a logical way and a way for us to remember, there's the 5 C's, which you are going to be hearing a lot about. The 5 C's help us to characterize that complaint that the patient has come with, and to help us to be able to narrow down to find out what is really the problem. The 5 C's stands for first C, complaint; the cause, C-A-U-S-E; the course, C-O-U-R-S-E; the complications from that particular complaint, and then the care given so far. So this is what constitutes the 5 C's. Now, there will be videos that will discuss symptomatology of particular symptoms that patients are presenting with. For all the common symptoms, there are videos on them, and you can look at them to be able to have a better grasp of history. Now we'll move to the past medical history of the patient. Patients that have chronic conditions such as epilepsy, asthma, hypertension, diabetes, sickle cell disease, is important. Peptic ulcer disease is important for us to capture this as part of our history. The patient can also have any other chronic conditions such as chronic liver disease, chronic renal disease. So all this, any of these that is part of the history of that patient will be mentioned at this particular time, and not just mentioned and described. So for example, my 65-year-old Fulani man who resides in Apapa is also a known hypertensive of 10 years duration, and he's regular on prescribed medications. If you know the names of the medications from the history, you can add it at this point. He's regular on valsartan and amlodipine, for example. So, and he's regular on the medication. So this gives us a stronger idea of the past medical history of that patient. If the patient has had surgeries in the past, also, this is the point we are going to add it. If the patient has been hospitalized recently, we also add it in the past medical history of the patient. We want to also know if the patient has received blood transfusion in the past before. So this is what constitutes the past medical history. So chronic illnesses like chronic liver disease, chronic kidney disease, hypertension, diabetes mellitus, sickle cell disease, peptic ulcer disease, all history of blood transfusion, history of recent admission in the hospital, all this will be captured in our past medical history. Now, for a pediatric patient, as I told you, the nitty-gritty of the past medical history of that patient will include the prenatal, natal, and postnatal history of that patient, the immunization history of that patient, and it's important for you to have a very good understanding and idea of the immunization schedule, the national program on immunization. Have a schedule so that you know at what age is the patient receiving what particular vaccine. It's important that you have this both in real life and in the exam. Now, after the immunization history, you want to know the dietary history. If the patient was, for example, exclusively breastfed, and at which point complementary feeding was introduced, and at which point the patient was weaned off breastfeeding totally to join the regular family diet. Also want to know the history of developmental milestones, such as when the patient started sitting, crawling, walking. The details of all this for pediatrics will be captured in another video. After this, we want to know the family and social history. In the family and social history, we want to know the following. We want to know the family structure: monogamous, polygamous, number of children, number of wives, and we want to know the living condition: how many individuals per room, what is the ventilation of the room, what is the source of drinking water, what is the source of sewage disposal, the proximity of the kitchen to the restroom in the house. All this should be captured in the family and social history. As part of the social history, you want to know if the patient takes any recreational drugs, and this is very important. If the patient smokes or takes alcoholic beverage, you have to capture this as part of the social history of that particular patient. And now we're talking about smoking, alcohol, use of tobacco, use of snuff, use of any stimulant will be captured in this particular part of the history. Next, we want to do the review of system. In the review of system, at this point, I think it's important for you to go and learn, symptomatology. Having at least 10 symptoms for every system of the body and 10 signs for every system of the body is also important to help you to be able to really, describe symptoms and be able to ask to know if these symptoms are associated with a particular complaint that the patient is having. For example, I use having 3 symptoms to ask of, 3 classical symptoms for particular systems will be helpful. So for example, in the CNS, we want to ask for history of loss of consciousness, headache, blurring of vision. We want to that will capture or neck stiffness. That will capture typical symptoms from the nervous system. In, for example, in the chest, we want to ask for history of breathlessness, cough, difficulty in breathing, or pain in the chest. Typical. For the gastrointestinal system, we want to ask for history of vomiting, diarrhea, yellowish discoloration of the eyes, hematemesis, or hematochezia, or melinal stool. These will be very classic symptoms from the gastrointestinal system. For the urogenital system, we want to ask for history of, for example, frequency, urgency, dysuria, nocturia. We want to also ask for urethral discharge, vaginal discharge. This will give us, these are very classic history for the particular system. For the musculoskeletal system, if there are any pains, any swellings, we want to also capture this. I talked about obstetrics and gynecological history. Now, for the obstetrics part of the history, we want to ask for number, and of course this will be for females, number of pregnancies ever had. And then you characterize each of those pregnancies. Were they desired? Was it spontaneously conceived, as opposed to, for example, in vitro fertilization or artificial or that? We want to also know if the pregnancy was booked, if there were any drugs used during pregnancy, for example, alcohol, which you're actually going to tell the baby. If there were any illnesses during the pregnancy, we want to know where the pregnancy was booked, how the pregnancy was delivered. Was it spontaneous vaginal delivery? Was the cesarean section done? What was the perinatal history of that patient? So all this will capture in the obstetrics for each of the index pregnancies that have been had by the individual. Also, for gynecological history, we want to know the cycle length for the woman. We want to know the number of days of bleeding. Then we want to know if there is history of menorrhagia, dyspareunia, dysmenorrhea, if the patient is aware and uses contraceptive, and if the patient has ever done a pap smear. So this will constitute the obstetrics and gynecological history. At the end of the day, now we've done the review of system. At the end of the day, we want to summarize the most important points that you've gotten from the history. The summary should contain a brief biodata. For example, 65-year-old Fulani man, known hypertensive, who presented on account of headache, fever, and breathlessness. There was no history of neck stiffness to rule out, for example, meningitis, and there was no history of leg swelling or easy fatigability. Just from my symptoms, I'm telling you the positives and the important negatives. Patient has been on admission for 4 days now and has remarkably improved. This gives you a sort of a highlight of the history of my 65-year-old who lives in Lekki, in Lagos. So this is a general overview to history taking. History taking, as I said earlier, the more you clerk, the more you present, the better you become at it. As I said earlier, there's going to be a part of this video that will discuss history taking, the nitty-gritty for pediatrics patients. There's also going to be a part of this video that will discuss important, not important, all the common symptoms that are presented usually, and how we can use the 5 C's to tackle them. There will be other videos too on examination and all that. If you enjoyed this video, share with your classmates and have a wonderful clinical experience. Thank you.